Hi to all CPC aspirants. Welcome to the channel Code Easy. Today, let's learn about compliance and regulatory for CPC examination. Compliance and regulatory section will test your knowledge in Medicare and its parts. ABN, place of service reporting, HIPAA, fraud and abuse, NCCI and its edits. Let's start with Medicare and its parts. In most of the countries, primarily insurance is provided by private insurance companies and government. In United States, government provides so many insurances, out of which Medicare and Medicaid are most prominent. Medicare is the government insurance which covers the people with age 65 and above. It has 4 parts, Part A, Part B, Part C, and Part D. Medicare Part A covers institutional services provided in hospital inpatient, which is also known as acute care facility, skilled nursing facility, hospice, and also some of the home health care. Medicare Part B covers physician or outpatient services, outpatient hospital care, physical and occupational therapy, and some outpatient prescription drugs. Medicare Part C covers both inpatient as well as outpatient, but through private insurance company. Medicare Part D covers prescription drugs. Now that we understood Medicare and its parts, let's see what are the questions that most often being asked. First and foremost, which part of the Medicare covers the services provided in nursing care facility? Definitely the answer is A. Medicare Part A. Second question, which of the following services are covered by Medicare Part B? Medicare Part B will not cover inpatient services. Medicare does not cover dental care as well as assisted living facility. So the answer will be B. Physician's office is nothing but an outpatient facility. Outpatient facilities are covered by Part B. Moving on to the next topic, Advance Beneficiary Notice or ABN. It is a notice given by healthcare facility to the Medicare patient before providing the services to inform that a service may be denied by Medicare or may not be covered by Medicare. This notice will allow the patient to make a choice whether to receive the service or not. If he is receiving the service, he has to pay out of his pocket if Medicare denies. This is what is ABN. Let's see what are the questions that are asked from this topic. First and foremost, an ABN is a notice given to a patient to sign and acknowledge that Medicare may deny the service or procedure. What does ABN stands for? Definitely Advance Beneficiary Notice. Question 2. What notice is given to a Medicare patient to sign so that it will hold the patient responsible for payment when certain medical service is performed and is denied by Medicare? Again, answer is Advance Beneficiary Notice. Moving on to next topic, place of service reporting. There are place of service codes used in the claim form to specify exact location where the healthcare services are provided. For example, if the services are provided in physician's office, the code reported will be 11. If the services are provided in skilled nursing facility, code reported would be 31. Let's see the questions that are asked from this section. Question 1. Which place of service code should be reported on the physician's claim for a surgical procedure performed in an ambulatory surgery center, also known as ASC? Let us go back and refer the place of service codes table. Ambulatory surgery center is what is here. The code is 24. Answer is C. Moving on to next question. Which place of service code is submitted on a claim form for a service performed in a nursing home or nursing facility? Again, referring to place of code services table, nursing facility is here and the code is 32. Coming back to the question, again, C is the answer. This place of service codes are available in CPT book as well as HCPCS book. Moving on to the next topic, HIPAA, Health Insurance Portability and Accountability Act. It is enacted to establish nationwide standards on protecting sensitive patients' health information. There are two core rules set by HIPAA. First one is privacy rule and the second one is security rule. The privacy rule establishes conditions and limits on how protected health information, which is PHI, can be used or disclosed. The next one is security rule that sets national standards for protecting confidentiality, integrity, and availability of EPHI. EPHI means electronic protected health information through administrative safeguards, physical safeguards, and technical safeguards. Now, what are the questions that may be asked from this section are: HIPAA stands for, it is Health Insurance Portability and Accountability Act. Question 2 is PHI stands for, it is Protected Health Information. Moving on to next topic, frauds and abuse. Frauds are done intentionally or deliberately misrepresenting or deceiving for financial benefits. Okay, examples of fraud are billing for services not rendered, upcoding, falsifying medical record to support fraudulent claims. Moving on to next is abuse. Abuse is unintentional practices that may lead to improper billing. Usually these are by mistake. Examples of these are unbundling, billing for services that are not medically necessary, and unintentional errors in coding or documentation that leads to overpayments. These are some of the examples of abuse. Now, what questions are being asked from this topic is, which of the following scenarios is considered an abuse? Definitely, it is unintentional. Abuse is unintentional or by mistake is what is abuse. Intentional, deliberate is always fraud. Unintentionally billing for unnecessary medical service is what is the answer for this question. Moving on to next topic is National Correct Coding Initiative, NCCI. It is developed by CMS, Centers for Medicare and Medicaid Services, to promote correct coding and also to reduce improper payments. NCCI has formulated two types of edits. First one is procedure to procedure edits. Next edit is medically unlikely edits. These are the two edits formulated by NCCI. Now, what are the questions that are asked from this section are? Question 1. Procedure to procedure edits of dash prevent inappropriate payment for unbundled services that are bundled together. Answer is National Correct Coding Initiative, NCCI. Question 2. Program developed by CMS to promote correct coding methods and to control inappropriate payment of Part B claims and hospital outpatient claims. Again, the answer is National Correct Coding Initiative. These are the questions that are often asked in compliance and regulatory for CPC examination. If you really like this video, please subscribe, share and like. Thank you.